isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity.
Hello, and welcome to this restful space. Take a moment to breathe deeply and settle in. Today we're going to explore something essential yet often overlooked: how what you put into your body affects the health and appearance of your skin. Your skin is your body's largest organ. It's not separate from the rest of you. It's deeply connected to your overall health, your nutrition, your hydration, and your internal well-being. While topical skincare products are valuable, they work best when supported by healthy habits from within. Let's begin with water, the foundation of life and of healthy skin. Your body is approximately 60% water. Your skin, particularly the deeper layers, contains a significant amount of water. This water is essential for every cellular process, for delivering nutrients to your skin cells, for maintaining your skin's plumpness and elasticity, and for flushing out toxins. When you're dehydrated, your skin shows it. Dehydrated skin looks dull and feels tight. Fine lines appear more prominent. Your skin may feel rough or flaky. In severe dehydration, your skin loses elasticity. When you pinch it gently, it doesn't spring back as quickly as it should. So how much water should you drink? The old 8 glasses a day rule is a reasonable guideline, but your actual needs depend on many factors: your body size, your activity level, the climate you live in, and your overall health. A more personalized approach is to pay attention to your thirst and the color of your urine. If you're thirsty, drink. If your urine is dark yellow, you need more water. Pale yellow is ideal. Drink water consistently throughout the day rather than trying to gulp down large amounts all at once. Your body can only absorb so much at a time, and steady hydration is more effective than sporadic large intakes. Start your day with a glass of water. Keep water nearby as you work or go about your activities. If you find plain water boring, add slices of lemon, cucumber, or fresh herbs for natural flavor. Herbal teas count toward your hydration as well. But here's an important nuance. Drinking water alone won't magically perfect your skin. If you're already adequately hydrated, if you're drinking when thirsty and your urine is pale yellow, drinking more and more water won't provide additional benefits. Your skin can only hold so much water, and any excess is simply eliminated. What matters is consistent, adequate hydration combined with products that help your skin retain that moisture. This is where topical hydrators like hyaluronic acid come in. They help your skin hold on to the water you're providing from within. Now let's talk about diet and skin health. This is where things become both fascinating and complex. The relationship between diet and skin is real but nuanced. No single food will transform your skin overnight, and no single food is likely ruining your skin either. What matters is your overall dietary pattern over time. Let's explore nutrients that support skin health. Omega-3 fatty acids help maintain your skin's lipid barrier, which keeps moisture in and irritants out. They also have anti-inflammatory properties that can help with conditions like acne and rosacea. You'll find omega-3s in fatty fish like salmon, mackerel, and sardines, as well as in walnuts, flax seeds, and chia seeds. Aim to include these foods regularly in your diet. Antioxidants protect your skin from free radical damage caused by sun exposure, pollution, and normal metabolism. Vitamin C and E are powerful antioxidants. Vitamin C also supports collagen production. You'll find vitamin C in citrus fruits, berries, bell peppers, and leafy greens. Vitamin E is abundant in nuts, seeds, and avocados. Vitamin A supports skin cell production and repair. You'll find it in orange and yellow vegetables like carrots, sweet potatoes, and squash, as well as in dark leafy greens. Your body converts the beta-carotene in these foods into usable vitamin A. Zinc supports skin healing and helps control oil production. It's found in oysters, beef, pumpkin seeds, and lentils. If you struggle with acne or slow wound healing, ensuring adequate zinc intake might help. Protein provides the amino acids your body needs to produce collagen, elastin, and other structural proteins in your skin. Include adequate protein from sources like lean meats, fish, eggs, legumes, or tofu. Now let's address foods that might negatively affect your skin. The research here is less definitive and individual responses vary significantly, but certain patterns emerge. High glycemic foods, those that cause rapid spikes in blood sugar, may worsen acne for some people. This includes white bread, white rice, sugary snacks, and sweetened beverages. When blood sugar spikes, your body produces more insulin and androgens, which can increase oil production and inflammation. This doesn't mean you must eliminate all carbohydrates or sugar. It means choosing complex carbohydrates like whole grains, which release sugar more slowly, and moderating your intake of refined sugars and processed foods. Balance and moderation are key. Dairy, particularly skim milk, has been associated with acne in some studies. The hormones naturally present in milk might influence your own hormone levels and oil production. However, not everyone responds to dairy this way. If you suspect dairy affects your skin, try eliminating it for 4 to 6 weeks and observe whether your skin improves. If it does, you've identified a trigger. If it doesn't, dairy likely isn't an issue for you. Alcohol dehydrates your body and can dilate blood vessels, potentially worsening conditions like rosacea. It also taxes your liver, which plays a role in detoxification and skin health. Moderate consumption, 1 drink occasionally, is fine for most people, but excessive regular drinking can definitely impact your skin negatively. Highly processed foods often contain inflammatory oils, excessive salt, and artificial additives. While occasional consumption won't harm you, a diet dominated by processed foods doesn't provide the nutrients your skin needs and may promote inflammation throughout your body, including your skin. Here's what a skin-supportive diet looks like in practice. Plenty of colorful vegetables and fruits, adequate protein from varied sources, healthy fats from fish, nuts, seeds, and avocados, whole grains rather than refined carbohydrates, moderate amounts of dairy if you tolerate it well, limited processed foods and added sugars, and adequate water throughout the day. Notice that this is simply a generally healthy diet. There's no magic skin diet that differs dramatically from what supports your overall health. When you nourish your body well, your skin benefits along with everything else. Let's talk about supplements because many people wonder if they should take supplements for skin health. If you eat a varied, balanced diet, you probably don't need supplements specifically for your skin. However, certain deficiencies do affect skin health, and supplementation might be helpful in those cases. If you live in a northern climate, have darker skin, or spend little time outdoors, you might be deficient in vitamin D. Your doctor can test your levels. Vitamin D supports skin cell growth, repair, and metabolism. If you don't eat fish regularly, an omega-3 supplement might benefit your skin and overall health. Look for high-quality fish oil, or, if you're vegetarian, algae-based omega-3s. If you have diagnosed deficiencies in zinc, vitamin A, or other nutrients, supplementation under a doctor's guidance is appropriate. But don't take supplements speculatively or in megadoses. More isn't better, and some vitamins can be harmful in excess. Collagen supplements have become popular for skin health. The evidence is mixed. Some studies suggest they might improve skin hydration and elasticity, while others show minimal benefit. If you want to try collagen, look for hydrolyzed collagen peptides, which are more easily absorbed. But manage your expectations. Collagen supplements aren't miracle workers. Probiotics might benefit skin health indirectly by supporting gut health, which is connected to skin conditions like acne and rosacea for some people. However, the research is still emerging, and not everyone will see skin improvements from probiotics. Before taking any supplement, consider whether you might get the same nutrients from food instead. Supplements are meant to supplement a healthy diet, not replace it. And always inform your doctor about supplements you're taking, as they can interact with medications. Now let's discuss the gut-skin connection because this is an area of growing research and understanding. Your gut microbiome, the community of bacteria and other microorganisms in your digestive system, influences your overall health, including your skin. An imbalanced gut microbiome has been linked to inflammatory skin conditions like acne, rosacea, and eczema. Supporting your gut health may support your skin health. Here's how. Eat probiotic-rich foods like yogurt, kefir, sauerkraut, kimchi, and other fermented foods. These provide beneficial bacteria. Eat prebiotic-rich foods like garlic, onions, leeks, asparagus, and bananas. Prebiotics feed the good bacteria in your gut. Eat plenty of fiber from vegetables, fruits, and whole grains. Fiber supports healthy digestion and a diverse microbiome. Limit antibiotic use to when it's truly necessary, as antibiotics kill beneficial bacteria along with harmful ones. Manage stress, which can disrupt your gut microbiome. Again, these are practices that support overall health. The connection between gut and skin is one more reason to care for your whole body, not just your skin in isolation. Let's address a common question. Can food allergies or sensitivities cause skin problems? Yes, sometimes. True food allergies can cause hives, swelling, or rashes. Food sensitivities, which are different from allergies, might manifest as chronic skin issues like eczema or acne for some people. If you suspect a food is affecting your skin, the most reliable way to investigate is an elimination diet under the guidance of a healthcare provider. You remove the suspected food completely for several weeks, then reintroduce it while carefully monitoring your symptoms. This helps you identify true triggers versus coincidental correlations. Don't eliminate entire food groups based on speculation or unproven theories. This can lead to nutritional deficiencies and an unhealthy relationship with food. If you have concerns, work with a doctor or registered dietitian. As we come toward the close of our time together, let's remember the big picture. Your skin is part of your body, not separate from it. What supports your overall health supports your skin. Hydration, nutrition, gut health, sleep, stress management, all of these affect your skin along with every other part of you. You don't need a perfect diet to have healthy skin. You don't need expensive superfoods or restrictive elimination diets. You simply need to nourish yourself consistently and adequately with real, varied, whole foods and plenty of water. When you eat a varied diet rich in vegetables, fruits, whole grains, healthy proteins, and good fats, you're providing your skin with everything it needs to be healthy. When you stay adequately hydrated, you're supporting your skin's function and appearance. When you care for your gut health, you're potentially improving your skin along with your digestion and immunity. Topical skincare products are valuable tools, but they work best when supported by nourishment from within. Think of it as a partnership. Feed your skin from the inside with good nutrition and hydration. Care for it from the outside with appropriate products. Take a deep breath in and release. You now understand how hydration and nutrition support your skin health. May you nourish yourself with wisdom and without restriction. May you hydrate adequately and consistently. May you see your skin as part of your whole body, deserving of care from within and without. Thank you for this peaceful time together. Be well, nourish yourself, and trust that your body knows how to be healthy when you provide what it needs.
It's more sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring more careful barrier support during acne treatment. Sensitive skin becomes more common with age. Menopausal acne related to estrogen decline often requires hormonal approaches, hormone replacement therapy or other hormonal management, rather than relying solely on topical treatments. Dryness is more common with age and often worsens with acne treatments. Aggressive moisturizing becomes increasingly important with age. Combining anti-aging skincare with acne treatment becomes relevant in older adults. Using retinoids addresses both acne and aging simultaneously, though barrier support becomes more important. Sun damage accumulated over decades makes older adults more susceptible to post-inflammatory hyperpigmentation and other post-acne complications. Extra sun protection is crucial. Taking medications for various age-related conditions, blood pressure medications, cholesterol medications, etc., increases medication-acne interaction risks. Discussing acne treatments with healthcare providers familiar with your complete medication list is important. Guide 69, Acne Severity Scoring and Objective Progress Measurement. Objectively measuring acne severity and progress helps distinguish real improvement from perceived improvement and guides treatment adjustments. Several acne severity scoring systems exist. The Global Acne Grading System, GAGS, assesses lesion counts and types in different facial regions, providing an objective severity score. The Investigator Global Assessment, IGA, uses clinical judgment to rate severity on a scale. Various others exist with different approaches. Lesion counting helps objectively track progress. Counting comedones, blackheads and whiteheads, inflammatory papules, and pustules weekly or monthly provides objective data showing whether acne is improving. Photography provides visual documentation of progress. Taking consistent photos, same lighting, same angle, same time of day, monthly allows comparison showing improvement that might not feel obvious during the journey. Apps and digital tools can help track lesion counts, take comparison photos, and document progress over time. Severity scoring helps determine whether treatments are working and justify continuing them. If you're using a treatment and lesion counts aren't decreasing after 8 to 12 weeks, this objective data helps justify trying different treatments rather than continuing ineffective approaches. Baseline severity assessment establishes starting point for treatment. Knowing whether you started with mild, moderate, or severe acne contextualizes improvement. Someone improving from severe to moderate acne shows real progress even if not completely clear. Long-term tracking shows patterns, whether acne is generally improving, stable, or worsening over months. This helps distinguish temporary fluctuations from trends. Showing objective improvement to healthcare providers demonstrates treatment effectiveness and justifies continuing treatments or pursuing additional interventions. Guide 70, Acne and Physical Activity, Exercise Benefits and Sweat Management. While exercise's acne-triggering potential through sweating is often emphasized, the overall benefits of exercise for acne typically outweigh risks. Understanding how to exercise safely while managing sweat-related acne allows enjoying exercise benefits without acne worsening. Exercise benefits acne through multiple mechanisms: stress reduction, stress hormones worsen acne, improved sleep, critical for skin health, improved circulation, nutrient delivery to skin, hormonal regulation, particularly in women, and improved overall health. These benefits typically outweigh acne risk from sweat. Sweat itself doesn't cause acne. Bacteria combining with sweat, sebum, and dead skin cells in clogged pores causes acne. Managing sweat through hygiene and clothing prevents sweat-related acne. Sweating during exercise increases bacteria and creates moist environment promoting bacterial growth. However, showering within 1 to 2 hours after exercise removes sweat and bacteria before significant growth occurs. Wearing breathable, moisture-wicking clothing reduces sweat accumulation and bacterial growth compared to cotton or tight, non-breathable clothing. Avoiding touching your face during exercise prevents transferring sweat and bacteria to your face and spreading existing bacteria from your hands. Sports bras and tight athletic tops can cause friction and occlusion-related acne in those areas. Ensuring equipment is clean and fits properly reduces friction acne risk. Increasing hydration during exercise supports overall health and skin health. Well-hydrated skin functions better than dehydrated skin. Post-exercise cleansing is crucial. Showering or at least cleansing your face and areas covered by equipment prevents sweat and bacteria from sitting on skin for extended periods. The net effect of regular exercise is almost always positive for acne despite sweat concerns. The stress reduction, sleep improvement, and hormonal benefits typically outweigh sweat-related acne risks. Don't avoid exercise due to acne concerns. Instead, manage post-exercise hygiene properly. Guide 71: Adapting acne treatment for different body locations. Acne appearing on different body areas often requires treatment adaptation due to different skin characteristics and environmental factors across body regions. Facial acne, forehead, cheeks, nose, chin, is most common and receives most treatment attention. Facial skin typically tolerates stronger treatments better than body skin. Back acne, acne on chest and upper back, is common in males and can be severe. Body skin is thicker than facial skin and often tolerates stronger treatments. Back acne often involves larger lesions and deeper inflammation. Shoulder acne results from friction, bra straps, sweat accumulation, and clothing occlusion. Treatment combines friction reduction, sweat management, and topical treatments. Buttock acne results from friction from sitting, tight clothing, and occlusion. Prevention focuses on wearing loose, breathable clothing and good hygiene. Topical treatments similar to face can be used. Armpit/axilla acne results from sweat accumulation, friction from deodorants and antiperspirants, and occlusion. Gentle hygiene and avoiding irritating products help. Neck acne requires careful treatment as neck skin is thin and sensitive. Gentle treatments appropriate for sensitive facial skin are often better tolerated than stronger treatments. Scalp acne, acne on hairline and scalp, involves hair follicles and is often fungal or bacterial. Antifungal or antibacterial scalp treatments help. Keeping scalp clean, using clean hair products, and avoiding overly oily scalp conditions helps. General principle: treat body acne similarly to facial acne but account for thicker skin on body, can often tolerate stronger treatments, and friction/occlusion factors. Hygiene is even more important for body acne due to sweat and clothing occlusion. Guide 72: Acne Treatment and Athletic Performance. Does acne treatment affect athletics? Some athletes worry that acne treatments affect athletic performance. Understanding whether treatments impact performance helps athletes make informed treatment decisions. Benzoyl peroxide and salicylic acid don't directly affect athletic performance. These topical treatments have minimal systemic absorption.
Hello, and welcome to this peaceful moment together. Take a deep breath in and gently let it out. Today we're going to explore one of skincare's most versatile and gentle ingredients, niacinamide. In a world of complicated skincare ingredients with difficult names and harsh effects, niacinamide stands out as something beautifully simple. It's well-researched, well-tolerated, and works gently to address multiple skin concerns at once. There's no drama with niacinamide, no purging period, no sun sensitivity, just steady, reliable results. Let's begin by understanding what niacinamide actually is. Niacinamide is a form of vitamin B3, one of the essential nutrients your body needs. When applied topically to your skin, it works in harmony with your skin's natural processes, supporting and enhancing them rather than forcing dramatic changes. This is why niacinamide is so universally gentle. It's not introducing something foreign or aggressive. It's simply supplementing something your skin already recognizes and uses. Your skin contains natural niacinamide already. When you apply it topically, you're boosting those existing levels, allowing your skin to function more optimally. Think of it like giving your skin the tools it needs to do its job better. Now let's talk about what niacinamide can do for your skin. Its benefits are numerous and well documented. First, niacinamide strengthens your skin barrier. Remember, your skin barrier is that precious outer layer that protects you from the world and keeps moisture locked in. When your barrier is strong, your skin is resilient, comfortable, and healthy. When it's compromised, you experience sensitivity, dryness, and various skin issues. Niacinamide helps your skin produce more ceramides, those crucial lipids that fill the spaces between your skin cells, creating a strong protective barrier. It's like niacinamide helps your skin make its own mortar to strengthen the brick wall that protects you. A stronger barrier means less water loss, better protection against environmental stressors, and improved resilience overall. Your skin simply functions better when its barrier is strong, and niacinamide supports that strength. Second, niacinamide regulates oil production. This is particularly valuable if you have oily or combination skin, but even normal skin types benefit from balanced sebum production. Your skin produces oil, sebum, for good reasons. It provides natural moisture, protection, and keeps your skin supple. But sometimes sebum production becomes excessive, leading to shine, enlarged pores, and breakouts. Niacinamide helps normalize this production, bringing it back to healthy levels. Interestingly, niacinamide doesn't strip away oil or dry out your skin. Instead, it works with your skin's natural feedback systems to regulate production from within. Your skin learns to produce the right amount of oil, not too much, not too little, just enough. Third, niacinamide reduces the appearance of pores. Now, let's be clear. Your pore size is genetically determined, and you cannot permanently shrink pores. However, you can minimize their appearance, and niacinamide helps with this. When pores become filled with oil, debris, and dead skin cells, they stretch and become more visible. When oil production is excessive, pores appear larger. Niacinamide addresses both these factors. It regulates oil production and helps keep pores clear, making them less noticeable over time. Fourth, niacinamide brightens and evens skin tone. If you struggle with dark spots, post-inflammatory hyperpigmentation, or overall dullness, niacinamide can help. It works by inhibiting the transfer of melanin, the pigment that gives your skin color, from the cells that produce it to the surrounding skin cells. This doesn't stop melanin production entirely, which would be harmful. It simply reduces excessive transfer that leads to uneven pigmentation. Over time, with consistent use, you may notice your dark spots fading, your overall tone becoming more even, and your skin looking brighter and more radiant. This happens gradually, gently, without any peeling or irritation. Fifth, niacinamide has anti-inflammatory properties. Inflammation is at the root of many skin concerns: acne, redness, sensitivity, premature aging. By reducing inflammation, niacinamide helps calm irritated skin and prevents inflammatory damage. This anti-inflammatory effect makes niacinamide particularly valuable for sensitive skin types. While many active ingredients can trigger inflammation and sensitivity, niacinamide soothes and calms. It's one of the few active ingredients that's truly gentle enough for even the most reactive skin. Sixth, niacinamide provides antioxidant protection. Environmental stressors, pollution, UV radiation, smoke, create free radicals that damage your skin cells and accelerate aging. Antioxidants neutralize these free radicals, protecting your skin from oxidative stress. Niacinamide offers this antioxidant protection, adding another layer of defense against environmental aging. While it's not a replacement for sunscreen, it complements sun protection beautifully. Seventh, niacinamide can reduce fine lines and wrinkles. By supporting your skin's natural production of collagen and other structural proteins, niacinamide helps maintain firmness and elasticity. Over time, this can lead to smoother, more youthful-looking skin. This anti-aging effect happens gradually and naturally. Niacinamide doesn't force dramatic changes like some aggressive anti-aging treatments. Instead, it supports your skin's own repair and renewal processes, helping you age more gracefully. Now let's talk about using niacinamide in your routine. One of niacinamide's greatest strengths is its compatibility with other ingredients. Unlike some actives that conflict with each other, niacinamide plays well with almost everything. You can use it with vitamin C, retinol, AHAs, BHAs, essentially any other skincare ingredient. There's an old myth that niacinamide and vitamin C can't be used together. This has been thoroughly debunked. They work perfectly fine together and can actually complement each other's effects. Niacinamide is available in various product types: serums, moisturizers, toners, and treatments. The concentration typically ranges from 2% to 10%. Research shows benefits starting at around 2%, with most products formulated between 4% and 5%. Higher concentrations aren't necessarily better. Some people find that concentrations above 5% can cause slight irritation or flushing, though this is rare. If you're new to niacinamide, starting with a 4 to 5% concentration is ideal. You can use niacinamide both morning and night. It layers well under sunscreen in the morning and under heavier moisturizers at night. Many people apply it after cleansing and toning, before heavier serums and moisturizers. Because niacinamide is water-soluble, it absorbs quickly and doesn't leave a heavy or greasy feeling. Most niacinamide serums have a lightweight texture that layers easily with other products. Results from niacinamide take time. This isn't an overnight miracle ingredient. You'll typically begin seeing improvements in oil control and skin texture within 2 to 4 weeks. Brightening effects and improvements in dark spots take longer, usually 6 to 8 weeks of consistent use. The key word is consistent. Niacinamide works through steady, cumulative effects. Using it sporadically won't give you the full benefits. Incorporate it into your daily routine and be patient. The results are worth the wait. Who should use niacinamide? Honestly, almost everyone can benefit from it. It's one of the few truly universal skincare ingredients. If you have oily skin, niacinamide helps regulate excess oil and minimize pores. If you have dry skin, it strengthens your barrier and reduces water loss. If you have sensitive skin, its anti-inflammatory properties soothe and calm. If you're dealing with aging concerns, it provides antioxidant protection and supports collagen production. If you struggle with uneven tone, it brightens and evens pigmentation. Even if you feel your skin is perfectly balanced, niacinamide still offers preventive benefits, maintaining that healthy barrier, protecting against environmental stress, and supporting your skin's optimal function. Are there any downsides to niacinamide? Very few. It's remarkably well tolerated. Some people experience slight flushing with higher concentrations, but this is temporary and harmless. True allergic reactions to niacinamide are extremely rare. If you're using multiple products with niacinamide, that's fine. You won't overdose on it. However, if you notice any irritation, you might want to reduce the number of niacinamide-containing products in your routine. Let's address one common concern: niacinamide and niacin flush. Niacin, nicotinic acid, is a different form of vitamin B3 that can cause flushing, redness, and warmth. Niacinamide, nicotinamide, is a different form that typically doesn't cause this reaction. If you've experienced niacin flush from supplements, that doesn't mean you'll react to topical niacinamide. When shopping for niacinamide products, look for simple formulations. Niacinamide doesn't need a lot of fancy accompanying ingredients to work. In fact, simpler formulations often work better because there's less risk of irritation from other components. Store your niacinamide products properly. Cool, dark places are best, though niacinamide is quite stable and doesn't degrade easily like some other active ingredients. As we close our time together, remember that niacinamide represents everything good about modern skincare. It's evidence-based, gentle, versatile, and effective. It doesn't promise overnight miracles, but it delivers steady, meaningful results. This is an ingredient you can trust, one that works with your skin rather than against it. Whether you're addressing specific concerns or simply maintaining healthy skin, niacinamide supports your goals quietly and effectively. Take a deep breath in and release it.
Acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77: Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Noncompliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care. If single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is psychologically devastating. Escalating to professional dermatology care, combination treatments, or systemic treatments is appropriate. Professional dermatology can identify why treatments aren't working and recommend appropriate escalation. Don't tolerate inadequate acne improvement indefinitely. Professional help exists. Guide 78, Post-Acne Skin Health Maintenance and Prevention of Future Problems. After achieving clear skin, maintaining skin health beyond just preventing acne ensures long-term skin quality and prevents premature aging. Sun protection remains essential post-acne for preventing aging and ensuring any residual hyperpigmentation doesn't worsen. Sunscreen habit established during acne treatment should continue indefinitely. Barrier health maintenance prevents irritation and premature aging. Continuing appropriate moisturizing even post-acne supports barrier function. Regular exfoliation at appropriate frequency maintains skin clarity without over-exfoliating. Many people benefit from continuing gentle exfoliation, perhaps reduced frequency from treatment levels, long-term. Antioxidant skin care, vitamin C, green tea, others, support skin health beyond acne treatment. These can be incorporated post-acne for anti-aging and general skin health. Retinoids continue providing anti-aging benefits beyond acne treatment. Many people maintain retinoid use specifically for anti-aging rather than acne. Hydration remains important. Maintaining good hydration habits supports skin health long-term. Regular professional skin care, facials, peels, or other treatments, helps maintain skin quality and address any minor concerns before they become problems. Guide 79, Acne Education and Advocacy, Reducing Stigma and Improving Understanding. Acne stigma and misinformation continue affecting people with acne. Education and advocacy help reduce stigma and improve treatment access. Education about acne as a medical condition, not hygiene or lifestyle failure, reduces shame. Educating others about acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, just wash your face, or everyone gets acne, get over it, minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, those should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. I had acne and overcame it differs from I am acne-prone in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building your perfect personalized skincare routine, complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1: Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2: Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3. Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? Specific products? Environmental factors? Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle, 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional, monthly superficial chemical peels if available. Timeline, 8 to 12 weeks for significant improvement, 6 months for near-complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires relaxation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61, Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62, Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizer specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remains stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep quality and acne, mechanisms, optimization strategies, and sleep-specific skin care. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts